Dr. Grant Stevens, and I've been asked to say a few words about the article that's being published in the Aesthetic Surgery Journal on long-term follow-up of a reproducible, non-surgical approach to cellulite. I'd like to thank Phaedra and Dr. Nykiel and the editors of the Aesthetic Surgery Journal for publishing our long-term study and for giving us the opportunity to speak today to you. In this study, we had 8 investigators, so myself and 7 other investigators around the country, and we followed the patients for over a year, actually, and we're publishing the 12-month follow-up of these women who have all undergone an approach to their cellulite that is a novel technology, and you can refer to the article and see the results. The patient satisfaction is extremely high. And it's something that I encourage you to check out because we all get asked about cellulite. Over half of our patients in the world are women, and ourselves, we have 90+% women in our practices, and most of them have cellulite, and many of them would like a solution to the cellulite and the dimples and the waviness and so forth. And this is a reproducible approach that I encourage you to check out. The most important thing about this study and about this approach is it's durable. There's long-term results. This is not something that you do and a month later or 2 months later you need it. There's a lot of energy-based approaches that have really left us flat because they show temporary improvement. And the nice thing about this is that this is long-term improvement. Another nice feature of this technology is we can identify the fibrous septa. We can then release the fibrous septa, and more importantly, we can verify that we've successfully released it. So we identify it, we release it, and we go back and check again and verify that we've been successful in releasing the fibrous band and thus relieve the dimple. The other nice thing about this is that it's a consumable device. There's no capital device you have to buy. So there's no big expenses. You buy it, it's an appeal pack, you use it, you discard it, it comes sterile, and you don't have to buy a big technology to do this like in the past. So it's very approachable and very affordable. Now, I've been asked about advice I would give you if you'd happen to embrace this, and I've done this since the very beginning. I've had the good fortune of being involved in the development of this product. The first thing I would tell you is listen to the trainers. Listen to the proctors. They're going to tell you how to best do this. The people who listen and learn and reproduce what the trainers show have the very best results. I will tell you that the single most important thing you could do is mark the patient yourself. Mark the dimples and verify that you're dealing with cellulite and not just loose skin. That's so important. This is a treatment approach to cellulite, dimples, if you will, ice picks, not to redundant or loose skin. So marking yourself ensures that you'll know where to go, the target dimple. You'll identify it with the marking, you'll find it, you'll release it, and you'll verify it. The other important thing I would pass on is to set realistic expectations for the patient. Everyone's been disappointed with past approaches to cellulite. Set realistic expectations, not only for yourself and your staff, but most importantly for your patients. They need to know what to expect so they're happy, they're satisfied with their expense and with their treatment and so forth. I can't stress that enough. Now, I've been asked about future developments. I don't speak for the company when I say this. I know that many of us, myself included, have included this with combined procedures such as BBL and other total body 360 liposuction and so forth. So it's being used as in addition to other procedures, mommy makeovers and so forth. That's number one. Number two, for years I've been following up the releases with fat injections. I've been doing it myself. I harvest it in a small syringe and I follow my release. Now, what I've asked for is a simple device to inject the fat through the same release device. I can't guarantee they're going to do it. If they don't, you can do it the way I've been doing it and just put a little spacer in with the patient's own fat. It will make the buttocks even smoother and nicer as a little wafer there, right where you release the dimple. So that's what I hope they come up with, so it's all contained in one device. I want to thank you for this opportunity. I hope you give it a try. You can call me anytime. I'd be happy to walk you through it. I've done many of these for many years as we develop this product. Thank you once again.